On a chest X-ray, the pulmonary trunk forms a gentle curve. Sometimes it appears slightly prominent, especially in young women, which can be completely normal and not a sign of disease. On a chest X-ray, the pulmonary trunk can appear more prominent during deep inspiration. This enlargement is usually a normal finding and not a sign of underlying disease. When looking at a chest X-ray, the size of the pulmonary artery can appear smaller or larger depending on patient rotation, so proper positioning is very important. In atrial septal defect, the pulmonary trunk often appears enlarged on a chest X-ray due to increased blood flow from left to right shunting across the defect. In ventricular septal defect, increased blood flow from left to right shunt causes the pulmonary trunk to enlarge, which can be clearly seen on a chest X-ray. In patent ductus arteriosus, increased blood flow from the aorta to the pulmonary artery can cause the pulmonary trunk to appear enlarged on a chest X-ray. Tetralogy of Fallot is a congenital heart defect. X-rays show a concave pulmonary artery, boot-shaped heart, and decreased lung markings, all due to reduced blood flow to the lungs. Pulmonary artery cortictation is a rare congenital narrowing of a pulmonary artery branch. It causes uneven blood flow to the lungs, visible on imaging, and may lead to a heart murmur. Pulmonary valve stenosis causes the main pulmonary artery to enlarge. Chest X-ray shows a bulging artery segment. Heart size stays normal, unless severe stenosis leads to right heart failure. In TAPVAR, chest X-ray shows a prominent pulmonary artery, right heart enlargement, and sometimes a classic snowman sign. If obstructed, pulmonary edema with diffuse haziness appears. Tricuspid atresia is congenital. On X-ray, the main pulmonary artery is small or concave due to reduced flow. The heart is usually normal-sized, with reduced pulmonary vascular markings. Truncus arteriosus is a congenital heart defect with a single large vessel from the heart, causing cardiomegaly and a widened mediastinum on chest X-ray, with increased pulmonary blood flow. In Ebstein's anomaly, chest X-ray shows marked cardiomegaly from a huge right atrium, decreased pulmonary markings, and a small or obscured pulmonary trunk due to the enlarged heart. In pulmonary artery hypertension, chest X-ray shows an enlarged main pulmonary artery, convex left segment, dilated right artery, and pruned peripheral vessels. Right ventricular enlargement may also be seen. In acute pulmonary embolism, chest X-ray may show sudden dilatation of the central pulmonary trunk and an enlarged pulmonary artery knuckle, known as the Fleischner sign of PE. High output states like anemia, thyrotoxicosis, or pregnancy can cause a prominent pulmonary artery and enlarged vessels on chest X-ray. The heart may enlarge with high output failure. Idiopathic dilatation of the pulmonary trunk appears as an enlarged main pulmonary artery with normal heart and lungs. There's no hypertension or shunt, just a striking, isolated vessel enlargement. In Marfan syndrome, chest X-rays may show a widened pulmonary artery, even if pressure is normal. This prominent pulmonary knob can mimic pulmonary hypertension and often occurs with aortic dilation. Pulmonary artery sarcoma is very rare, but may show on X-ray as a widened pulmonary artery or hilar mass. It can look similar to pulmonary hypertension or a large embolus. Behçet disease can cause multiple pulmonary artery aneurysms, seen on chest X-ray as large hilar contours or round lung opacities. Rupture may show regional consolidation or infarcts. In summary, when assessing the main pulmonary artery on a chest X-ray, remember to use the red line drawn from the aortic knob to the left heart border as your reference. A normal pulmonary artery should lie just medial to this line, typically within 1.5 centimeters. Recognizing this key landmark can help you quickly identify abnormalities and improve diagnostic confidence. Thanks for watching.